The most significant effort we made in research for the treatment of headache of migraine are the so-called CGRP antibodies. This is a completely new class of substances which are specifically aimed to treat migraine, not any other pain condition, but only migraine. And these CGRP antagonists prove to be very efficacious and very safe and without any side effects. The most important challenge in treating migraine patients is that we don't have a cure for migraine. Migraine is an inherited disorder. That means we don't have a real cure, but we want to make the patients as migraine-free as possible. And for this we need a good prophylactic treatment. This means to have a drug which lowers the frequency and severity of migraine attacks. For migraine prophylaxis, we have some drugs in the past which are working in about 2/3 of all patients. However, these drugs have several side effects, and the compliance of the patients to take these drugs is rather poor because of the side effects, because you have to take this drug every day, so you are reminded to your migraine every day. And therefore, the challenge is to have a new kind of treatment for the prophylaxis of migraine. The most exciting area, I think, is that we will have new substance classes to treat migraine. We started in the last years with a new substance class called the CGRP antibodies. But that's not the end of the story. We have other new substance classes, just as an example, the so-called PACAP antagonists. So we will have new treatment options for migraine, very specific for migraine, not just pain treatment, but specific migraine treatment. And I'm very excited that we will have new treatment strategies and more efficacy in these new substance classes. The message is that migraine headache research and treatment is an exciting field in neurology. I know that many people think headache is headache and you shouldn't care about too much. However, first, migraine is the most disabling neurological disorder worldwide. This is not known really, but the WHO lists migraine on place 6 of all disabling disorders. And this is the first neurological disorder. It's more disabling than multiple sclerosis or stroke or Alzheimer's disease. So there is a lot to do to help people. Then it's very exciting that we know more and more about the basics and about the pathophysiology of migraine. We now know some genetic backgrounds. We know mutations in our genes causing specific types of migraine. And it's very exciting that we might have the clue how migraine develops and who is getting a migraine in the future. And finally, it's exciting times because after a gap of 20 years, we now have a major step forward to the treatment of migraine. We have completely new substances, very specific for migraine. And to be part of this development, I think, should be very exciting for young neurologists.